In this procedure, you'll learn to use feedback techniques to obtain patient information and accurately document patient care. Greet the patient pleasantly to help him feel at ease.
Hi, I'm Gabby.
Hi, Gabby. I'm Oscar.
Hi, I'm going to be updating your medical information today.
Introduce yourself and explain your role. To protect confidentiality and prevent interruptions, speak with the patient in a quiet, private area. Before you begin, verify his full name and date of birth. Explain that you need to collect some information from him. Complete the health history with the help of therapeutic communication and feedback techniques, using restatement, reflection, and clarification.
Mr. Dixon, I see here that you have a history of hypertension or high blood pressure. Is that correct?
Yes, it is. It's been about 6 months now, and I am taking metropolol, I think. Is that it?
Mm-hmm.
All right.
Do you know what dosage?
Yes, 25 milligrams.
Be sure to explain all medical terminology. Positive nonverbal behavior creates a friendly, caring atmosphere. Use a pleasant tone, speak clearly, and make occasional eye contact.
Now, what about heart disease? Have you ever had a heart attack?
Oh, no. Thank goodness.
Be aware of your own biases. Your needs and preferences may not be the same as those of another person. That makes the two of you different. It doesn't mean that one of you is wrong.
Has the doctor ever told you that you had elevated cholesterol?
Yes, I have high cholesterol. I'm going to tell you, I try to eat healthy. I stay away from the fast food joints. But I'm going to tell you, after getting off work when I do, it's just so convenient.
Yes, I understand. Coffee's my weakness. I started to cut back and then they put that shop in the lobby. Talk about convenient.
Be sensitive to the patient throughout the interview, especially if you must convey unwelcome or troubling information.
So, Gabby, can I ask you a question?
Sure, go right ahead.
Somebody told me that there is no cure for high blood pressure. Is that right?
It is true that the type of high blood pressure you have does not have a cure. But the good news is it is manageable. You just have to stay on top of it, and that's why you're here today.
Apply active listening skills. Make sure the patient understood the message and give him time to respond.
Well, let's get at it then. So let me then ask you, Gabby, is there anything else that I can do other than medication?
To make sure you understand the patient's message, restate or paraphrase his response. Doing so also gives him an opportunity to reply in greater detail.
Yes, we will definitely keep controlling your high blood pressure with medication, but there are lifestyle changes you can make too.
Use reflection to show that you recognize or identify with the patient's feelings. In fact, using feeling words in your response demonstrates that you're attentive to the patient's emotions, such as frustration or anxiety.
I know that I need to exercise more. That's a given. But Gabby, 2 kids, 2 dogs. I just don't have time to get to the gym. Ugh.
It can be natural to feel a little discouraged. Try to remember, though, that increasing your activity can be as simple as taking the stairs at work or walking the dogs more often.
Clarify and summarize what you've learned, and check the accuracy of the information you've collected.
So, it sounds like you do want to take control of your blood pressure.
Most definitely, yes.
Great. I'll ask Dr. Shepard to get you in touch with a dietitian, and he'll teach you about making healthy, quick choices.
Continue the exchange until the message is clear.
Oh, and let me give you some information on fitting more physical activity into your daily schedule.
Analyze your communication. Doing so will continually improve the communication process among healthcare professionals, other staff members, and patients. Finally, demonstrate respect by thanking the patient for sharing information with you.
Thank you for sharing your concerns with me, Mr. Dixon.
Oh, no, Gabby, I thank you. You've been great. Thank you for all the info.
No problem.